Hi there, and welcome to the Mindful Marathon podcast. I'm your host, Dr. Michelle Quirk, a run coach and pediatrician. Mindful Marathon is all about helping runners of all types to run their own race. Whether you are a seasoned runner or you're just getting started, I want to let you know that you're welcome here and that you're in the right place. Hi, everyone, and welcome back to the podcast. Today, I have a very special guest with me. I have my friend, Dr. Jillian Rigert here. She is an endurance runner with lived experience of anorexia nervosa. She is a professional pivoter, I love that, currently in school for marriage and family therapy with a focus in trauma. She is a Martha Beck Wayfinder master coach who supports individuals with life and career transitions. And my favorite, she is the proud dog mom to the amazing Reese Griffin. So, Jillian, welcome to the show.
Thank you, Michelle. I'm so delighted to be here with you, and it's always an honor.
We caught up a while ago when this was called Conversations, and it was a YouTube channel. And so this is, I don't know how many years ago that was. So we've known each other for quite a few years now.
Yeah, absolutely. And it feels like we've known each other our whole life. I feel like kindred spirits.
Yes, I think that's right.
Yeah, yeah,
Okay. I said that you're a professional pivoter. Tell
yeah.
us a little bit about yourself and where you are right now.
All right. I claim to be a professional pivoter. It was actually, I think, Dr. Jesse Mahoney who offered me that. I was like, yeah, that resonates because I pivoted my career so many times. And the first time I changed careers was so difficult for me. And even the topic anorexia, I realized transitions were really hard in times of vulnerability when it came to falling back into eating disorder behaviors. And all those transitions were just very destabilizing times for most people. And so when I first transitioned, I was in oral surgery and I was in the military, and I thought my life was over. I thought everyone's going to judge me for quitting and that I was a failure for quitting. And I really struggled to get my life back on track after I transitioned into oral medicine. And I had transitioned because I had become suicidal while in residency, and the military put me in a medical evaluation board process when I got mental health support. And when I became suicidal, it was so painful for me that I numbed the pain by not eating. And that's where I spiraled into anorexia and was inpatient. So I say all that because I just had so much going on. And the thought about pivoting was so hard. And to give myself permission to pivot was so hard. And then after I got discharged from the military, I went into oral medicine, which is a specialty of dentistry for those that don't know. I was like, it straddles medicine and dentistry, so we do a lot of rotations in medicine. My focus became head and neck cancer. And I was like, there's something about this that's like, I like it, but I see myself doing a different role. And I was very interested in mental health. And so I was like, I was spending more time with psychiatry. I'm like, something about this just isn't exactly it. And after residency, I became faculty. I was positioned in the hospital-based dentistry program, which it still wasn't a great fit. And this was during COVID time.
Mhm.
So I got my first faculty position, hospital-based dentistry. For those that don't know, it's when people have medical illnesses that they're unstable for outpatient procedures, that they tend to have their dental procedures done while they are in an outpatient clinic or in the operating room. So that's the hospital-based dentistry component. And there I was hired to do more of the head and neck cancer workups and support individuals that were going through treatment. I was like, again, I didn't feel like it was in the right fit for me. And then when COVID happened, it shut down dentists
Yeah.
almost first, especially ones that were supporting people with medically complex needs who are more immunocompromised and in more vulnerable states. My first job out of residency wasn't a good fit. I was already thinking about quitting. Lo and behold, that happens a lot. But at the
Yeah.
time, I had a lot of self-judgment. But COVID took me out of the clinical setting, and at that time, I still hadn't improved from anorexia. I was almost very near death at that point. I had lost function of a lot of my organs, even to struggle walking. So this is a running podcast. So as an endurance runner, I struggled to walk around the block while maintaining my bowels because I had lost the support for that. And I was still running on the treadmill because I was compulsive, but I didn't have the support in my muscles to maintain my hip stability. So my hip kept falling out of alignment and then kept pinching a nerve. And it was just not in a great physical state. And mentally, I was numb. And that was all coming because when I got discharged from the military and I left surgery, I had made it so much mean about me being a quitter, not enough, all this stuff. And then I finally reached out to my oral medicine community. I was like, okay, I'm looking for a new job. I was offered this email that there was a radiation oncologist somewhere in Texas looking for someone that was out of residency in dentistry to join their radiation oncology team. And it was a research position, a perfect fit for me who loves research, loves being able to advance patient care. And it was in
Mhm.
head and neck cancer, my niche. So the post that was emailed to me was on Twitter. So I get onto Twitter. I had to get an account and I message this person who's a radiation oncologist. He meets with me, I think it was the next day, interviews me, and we ended up kind of fast tracking from there. I was in Michigan at the time, fast tracking to join him at an institution. It was at MD Anderson for head and neck cancer. It was a very great institution to be at. I was quite honored to be able to be selected there. And again, just kept pivoting. I kept pivoting, and I was like, okay, I guess I'm getting better at this pivoting stuff. So I'm becoming this professional pivoter. And I was like, something that was so hard for me, it just became, it was so hard for me to think about changing my career. And then all of a sudden it became what I did. I just became a career changer, but it's more of a career evolution.
Yeah.
And especially because in the beginning, the first pivot was so hard. And
Yeah.
that was the most vulnerable time. And so the radiation oncologist is married to a marriage and family therapist.
Okay.
And he went to the school that I am going to now for marriage and family therapy. So I got exposure to different elements of the oncology team, and I tried to position myself. Okay, my favorite part is to be with people who are going through very serious illness because my illness was life-threatening and I was very alone. I don't want people to feel alone and scared. And so I like to be there for their psychosocial and spiritual support. However, as an oral medicine clinician, they don't get paid to just be there and counsel. So, okay, if I want to do that more and for that to be more of my career, and at the time also I was coaching physicians and other professionals that were going through everything in life, but mostly life and career transitions and like, who
Yeah.
am I and what am I doing? What's my purpose and meaning in life? And so I was like, okay, so I loved the coaching aspect. I loved to be at the bedside. And ultimately, I was like, in order to do this more sustainably, I have to change my career. And the marriage and family therapy it made the most sense. And marriage and family therapy differs than the medical model because it's very systemic based. And it just wasn't my experience, especially with an eating disorder, which there's a lot of systemic components.
Yeah.
So that's why I went that way in terms of the next step in the
Yeah.
journey, my career evolution. And what do you do then? You have so many different hats. Like, how would you create a bio and try to put one of those on there and it makes sense? And I no longer identify with a career because my very tight attachment to being a military surgeon, the
Mm.
loss of that nearly killed me, literally. So I was like, I'm no longer going to attach to something that puts me in that vulnerable of a state.
Yeah. But you do identify as an endurance athlete and a
I
runner.
do,
Mhm.
absolutely. And that identity has been what has saved me from dying from anorexia, I believe.
Yeah. Can you
It's
talk
just,
about that? I met you, when did I meet you? In 2020-ish?
yeah,
Something like
something like
that.
that. 21 or 22.
And of course,
Yeah,
I didn't know any of this.
yeah. Isn't it interesting? And I think that's the very challenging thing for me to reconcile just because a year before I met you, a year or two is when I was the most medically compromised, where I almost died. My heart rate is in the 20s. I won't say weight because I know people find that to be very triggering, but I just structurally, like I said, I was like losing my organs. My white blood cells were 1.63 and
Wow.
I was not well and I felt fine.
I'm trying to think of how to ask the question. You say that you felt fine, but did you know that something was wrong?
I knew that other people thought I was going to die. They told me overtly.
Okay. Okay.
Yeah, they told
Mhm.
me overtly. Actually, people thought I was going to die when I was in residency. The fear on the internist's eyes it was very, I could see it. And the psychiatrist that I had, she's eating disorder trained, and she would just tell me, I knew that I couldn't see. I have body dysmorphia. I knew I couldn't see what they were seeing. I knew objectively what my weight was. I knew objectively what my heart rate was. I knew
Yeah.
objectively. And I think part of it was dissociation, probably is a big part of it. And also, I was so in residency with the suicidality, there was some apathy there. It was like, this is my passive way to die. And God, it's a much less brutal way for me to think about dying than alternatives that I could have thought of at the time. But there's part of me that thinks I didn't believe I was going to die. I just felt that's what happened to me. So it felt like even looking at my medical documents now, or when I was inpatient, the attending said, you talk about yourself like you're talking about someone else. That's how it feels in my brain.
Yeah.
So I can tell you this whole story, and I remember everything that happened to the best of my recollection, as much as we can remember. My brain remembers the fear on the people's eyes, my heart rate being in the 20s, the doctors running in and running out of my rooms, like, are you alive or not? I'm like, I'm gonna feel fine. So I think I just adapted to the way I felt. And it was numb. It was just so numb. And so that was when I was so numb, that was part of my residency experience. And then again, in the 2020, 2021 time period when had hit a worse rock bottom because I thought resigning from surgery was going to be the hardest part, but it was the aftermath. It was being stuck with my own beliefs about myself, that shame and isolating. And then if you isolate, it worsens the shame. And then if you have an addictive behavior like anorexia or alcoholism or workaholism, it just makes that worse because shame thrives in isolation and
Hmm.
addictions are often attached to shame.
Yeah.
So I didn't meet people when I was about to die, and I don't post pictures. And I understand why people do. They want to prove that they were at that state, and I think it's unhelpful for a lot of people because, one, it can be quite triggering. If I see a
Yeah.
person who's very underweight, the part of me that's very influenced by the eating disorder gravitates towards it, wants it. And then for people also who see people that have to justify their eating disorder when they're very thin, that's a small percentage of people who are suffering inside from eating disorder thoughts and behaviors. So it invalidates their struggle, which is partly what I'm dealing with now is externally I look much more well. And even if I say I'm struggling with an eating disorder, people are like, oh, you don't look anorexic. And that to me has been a very harmful comment to receive because it perpetuates that belief. And then so I don't talk about it as much. And that's why I felt today when we were talking, I'm like, okay, maybe it's time for me to just talk about this because I know some of the block for me was hearing those comments where I tried to talk about it earlier. It was more proximal to almost dying from anorexia when I first came onto the scene again, being out in social
Yeah.
media.
Yeah.
But I was so close to that experience and to feel so much shame for being a more healthy looking body and then also being very much stuck in the eating disorder thoughts, it was more harmful for my ability to recover and move on. But the athlete identity was a big part that helped me because anorexia becomes an identity. And the competing identities, if I didn't have the one that helped me to pull out of the anorexia or to combat some of the other thoughts that I have, like I want to be a very strong athlete, then I would just be completely consumed with I want to be as small as possible. I don't
Mm.
deserve to eat, all these stuff. So it's kind of like this very interesting phenomenon with running because running can feed into the eating disorder and also it's
Yeah.
like almost kill me and save my life at the same time.
I want to ask you about that. Yeah. So you have always been a runner, right?
I started running in middle school.
Then how did you feel when you were going through all of this? I don't know, could you run? How were you running? You were trying to run.
I was very compulsive. Yeah. So I ran when I was in residency, I didn't have the same hip displacement issues. So I was running, I ran the day that I went inpatient, I ran the day I came out of inpatient.
Wow.
So not healthy, not helpful, not the best
Yeah.
thing to do, but like I could, so that's actually why I went inpatient because I knew I was going to struggle. I was going to struggle to eat. I was going to struggle to stop running. The
Yeah.
only way I could get myself to rest, which I know a lot of physicians say, I just wish I got sick and was hospitalized and broke my leg and had to stop. That was my experience. I was not going to be able to eat. I tried a lot, and I just had so much anxiety about fueling myself.
Mm.
And when I was comparing what they were having me eat inpatient, I remember the thought of I never would have been able to do this by myself because it was just so much more than I would have ever allowed myself
Yeah.
to have. And I think because I was doing a career transition at the time, I didn't do the step down that many people may do after coming out of inpatient. So I went inpatient to my appeal for the Air Force. They ultimately decided to discharge me. So I just went back in, I went into work and I didn't really continue the process of recovery. And it just shoved down so much, which came out later as worse, which is predictable. But
Yeah, I think this touches on it a little bit. I've had conversations with friends and non-runners who are like, running is an addictive behavior. And we discuss that. And I can see what you mean, but then in thinking about your story, I feel like these two things, as you said, the eating disorder and the running, were feeding each other in a way, but they are competing also.
Yeah. And I can even recognize it in running, like in the same run. If I'm very intentional, I tune into my the thoughts, the time. They're two very different thought processes that will drive the compulsive, addictive, self-harm behaviors.
Mhm.
And the self-compassionate, really doing it for enjoyment and for fun and love. I like love to see how far I can run. That was something that predated my severity of the eating disorder. I loved to see how far I could run. That was really fun. And it was my sense of peace and safety. And so the eating disorder could have taken that away from me, right? I'm like, no, this predated the eating disorder in terms of my love for running, being out there. It's been a really peaceful place for me. And something I was so excited to share with you when we last talked, and I just come off the half marathon, is that my training up to that point, I was doing very just the slow, easy runs you're supposed to do. And I was shocked because my time was a lot faster. And I was like, lo and behold, that's what people say, go slow, be gentle. And I was just shocked. I was like, wow, that's amazing. That actually worked. And I've been working with a dietitian and working with the dietitian, first of all, I love this dietitian. She's awesome. From former military, very just a good fit for me. And usually I would be done with the dietitians because that's my worst.
Yeah, that makes
I
you.
don't want them to tell me to eat anything. However, how this works for my brain is that it helps combat that I feel like I don't have permission to eat and being engaged with her and her giving me this thing. The rule becomes I have permission to do this because I'm working with this person. That's the thing that she wants. That's the good thing. That's the right thing. So I'm like, okay, I already know the alternative. If this doesn't work, if this fueling for some reason is just so life altering, horrible, I can go right back to what I've ever done and die from anorexia, right? That possibility, like that's a real thought in my head. It's okay, anorexia feels threatened right now because you're fueling yourself. I'm like, okay, I've already done that road so many times before. And what does help me is I'm going to table that thought for now, where you know where it leads. And there's that quote, if you want something you've never had, you have to do something you've never done.
Yeah,
So I motto that. I'm like, you know what? I don't know where this is going to lead, but I know the dark hole, the black hole I've been in with anorexia. I know how isolating it is. And being in marriage and family therapy right now, it's you don't want a therapist that looks super ill. I want to practice what I preach. I have all these nieces who are really important to me. When I was running the half marathon, there were all these kids there, and I'm like, I want to model very strong woman. That's who I
yeah,
want to be. That's who I want other girls to see. That's what I felt was important to me when I was younger. I loved being this super strong, capable person. And so I keep trying to keep that at the forefront of my mind. And so that voice comes out when I'm running. And when I know that I'm going in the wrong direction, it's like I feel like I'm just need to take everything out on myself and I get really tense. And it's just two different thought processes. You can kind of capture which one's ruling the show if you tap into the thoughts and how you're treating your body at the time.
yeah, yeah. I love that. And I think about the same thing. Right now, I have a niece who is very interested in running and running longer distance races with me. And so I always think about that. How am I modeling this exercise, movement, behavior, fueling, nutrition, all that stuff? It's maybe also on the day to day in my work as a pediatrician too, because yeah, there's just so much, and everybody's getting their information from the internet.
Which is, oh my gosh, and in the industry community too, we're all
Woo!
really, with all of the
Yes.
all
Yes.
the stuff going on right now, it's like the thin is in again. And I'm like,
Yeah.
wow, I think that even for me, because I've been through that so many times of that being something that my brain would latch onto. I feel very averse to it now because I've worked through that so much. I feel so sad. I feel sad that girls are going to believe that. And
Mhm.
I love that there's athletes that are combating that message and that are showing up to really provide a different story because it's so sad to me. You give up so much of your life to be smaller. And so when I almost died from anorexia, one of the most profound memories for me was I think in 2016, if I have the year, I flew from North Carolina to Utah for a residential treatment center that couldn't keep me in the program because my heart rate being in the 20s. They put me into a medical hospital. So I didn't have any phone number except for my mom, who was on a cruise. She did pick up, but I was like, oh, I'm here by myself in Utah in a hospital, and there's no eating disorder specialist here. And here I am alone. I may or may not die. And in that moment, I just thought, okay, I may or may not die. So much of what matters in my life, I had given up in order to get to where I was, like relationships, most of the things. And I was like, okay, so my achievements can't save me. The materialistic things that I own are going to be burdens. And like literally, was being as small as possible this accomplishment? What did it get me? So when my brain wants me to be smaller now, I'm like, okay, I'll remember that. I'm like, what did it actually get me? It stole so much from me. You lose so much more than weight in this obsession with weight loss.
Yeah. Do you have, this sounds like a daily, like intentional, you have to think about this intentionally every day.
I have strongly traumatic response. Like this, I don't even know if I intentionally think about. I do have to contemplate it. So I have my nervous system. I have what the psychologists called a foreshortened future, where I think I'm going to die all the time. If you asked me about the future and the planet, I will start to shake and sweat because I can't really see myself, picture myself in the future. I always think I'm going to die early. And it does give me death anxiety. To help myself with the death anxiety, I found, okay, the best combat of death anxiety is to live, like you said, intentionally, most intentionally.
Yes.
So I have very intrusive memories of these experiences, which is why it's hard for me when people have met me now and they don't know. They don't know
Right.
that I have this going on every single day. And so it was really traumatic. In order to create more post-traumatic growth from it, I'm like, okay, how can I create this to live more? One, I don't really care about people's opinions anymore because it's like they weren't there when I was
Yeah.
about to die. Really, I care about I care about your opinion. I care about people's opinion that I love, but it just helps me to show up and really, I'm like, I'm just going to be myself because I remember how close I was to die. We can die at any time. So to answer your question without me giving this huge monologue, like I have been, it feels like yeah, I get it. I'm pushed to feel it, to live more intentionally and to think about this more intentionally because it was so much part of my life that it's stored in my mind and my body as trauma. And that's also partly why I'm in marriage and family therapy. My track is trauma, and I became a trauma informed coach. And I'm very interested in trauma because where I lived before was not very safe. And my world kept getting smaller and smaller. I struggled to go in the clinic because of the associations. If I smelled anything dental, like
Yeah.
associations of when I was
Yeah.
actively suicidal and almost died from anorexia, they would keep coming up. And so every single day, it was just like the only thing I could do. I just got kind of trapped in my apartment in order to feel a sense of safety. So I lived online. And so then I moved to a different area, which is mostly forests. Jessie Mahoney had a lot of forest stuff, and I realized I was calm when I would engage
Yeah.
with her content on that. And so I intentionally moved to a forest, and I feel safe where I live. And so it helped me to reintegrate in life and to create more meaning. And actually, I went from working 5 days remote to now going into clinic most days of the week. And that wouldn't have been possible before because the amount of intrusive memories, the activation of my nervous system being such a constant thing was very kind of paralyzing for me.
Yeah. It sounds like you live in a lovely place at the moment.
I do. I do.
And good for walks with Reese.
Absolutely. There's a really cute dog park, and the place is very dog friendly. And the people, I feel like I find my sense of belonging alongside the people who live in the complex, live in an apartment complex, and very much aligned. We're like very spiritual and we're very much slow in terms of we like to not do the hustle culture. And I found my people here.
That's great. Where does running fit in for you now? I know you're a regular runner. This is
Yeah.
what we catch up about all the time.
Yeah, running to me, especially when it comes to the trauma, is I think we also talked about the importance of movement for many people when it comes to,
Yeah.
because all the energy that comes with trauma. You had also interviewed that one person, I'm forgetting his name right now, endurance athlete, Charlie Angle. Thank you.
Charlie
I'm
Angle.
sorry, I
Yes,
put
yes.
you on the
Uh-huh.
spot. A lot of people with trauma, with addictions, can find healing in running and the
Mhm.
importance of running. And for me, where running fits in is it really helps me to regulate my nervous system. And I run slower and I run compassionately for the most part. I still have a lot of those sort of thoughts and behaviors when it comes to earning your food and all that, things like that. And it's that yes, and I would say the majority of my running is because I want to be this really strong, capable, functional runner. And that half marathon I recently did, it just reinvigorated my connection with being that capable runner because I had so much fun doing it because I did it the right way. I didn't suffer through it. I was signed up for the marathon and I knew that was going to be a decision. If I did that, it wasn't the best decision, most compassionate decision, because in November I got sidelined from my neuropathy got really bad and I just was out in November. I had to reduce my mileage. So I knew I wasn't marathon ready. I could probably suffer through it, but I don't want to
Yeah.
suffer through anymore.
No.
I've suffered through enough, right? I've already put myself through that.
Yeah.
So yeah, so I run most days. I actually just started taking one day off per week, which was really hard to do. And I look forward to that. It's my Tuesdays because my Tuesdays are really long, from 8:30 a.m. to 7 at night for therapy with gaps in between, but they're just a long day for me. But it is for me now because I no longer want to subscribe to those
Yeah.
long days. I love to run. I look forward to running, and I know that I will be undertrained and under fuel if it gives me a stress headache to think about running or if I feel like I have to do it. And I'm not all 100% recovered on that part. And I do feel like for the most part, I would say an 80% recovered when it comes to my relationship with running from a thought-based standpoint.
I love that for you. I want to offer this to anybody listening. If this is resonating with you, if somebody is feeling stuck or if they feel like they need help or want to seek help, where would you point somebody, especially somebody who's maybe a student or a resident or in this busy season of life and you don't feel like you know which way is up?
Yeah, it's challenging in the eating disorder to recommend people because there can be a time and place where actually medicine people will invalidate someone's struggle. So for them to be aware if they think something's wrong and if anyone invalidates or minimizes your experience internally, I would seek someone else. So if they find the right person, that right person is listening, they validate that person's subjective reality when it comes to, I am struggling with this. And if a person's ready to admit that, I know for anorexia, I will deny the hell out of things when it comes to into myself, not to lie about it
Yeah.
but I don't see the struggle as
Yeah.
much as someone else does necessarily. So if you are already feeling that, that's a big awareness that some people might not think they have any issues and they might. So again, it's you want to find someone who you feel is validating you. You
Mhm.
feel safe. You feel like they didn't minimize what you're saying because so much of our medical model of care will utilize weight-based measurements and they will say you're fine because X, Y,
Yeah.
Z
Yeah.
and they'll prescribe eating disorders to people if they're not in the weight range that they think they need to be, and it's an awful situation. So it's hard for me to recommend specifically who they might go to, but that will be the signs that it's not the right person. If you feel like you are worse off because you tried to open up and be vulnerable and ask for help, and you will know you're with the right person if they provide compassion, curiosity, non-judgment, and they say, hey, this is how I'm going to help you, or they say, I'm not quite sure how to help you. Let me partner with you to figure out what we can do next.
Yeah. I think that's great advice. So before we go, can you tell everyone where they can find you and follow you?
Yeah, I'm on LinkedIn more, so that's something that they can find me on. If they want to find me on YouTube, they can just search my name on that because who knows if I'll change the title. It's currently called A Life True to You, it has the elements of permission to pivot, really about creating the life that's authentic to us and navigating life and career transitions.
Okay, love it. And we can follow your running adventures as well.
Yeah, I'm on Instagram for my running adventures, but I just feel like Instagram will be a dying thing at some point soon. It's like masked and very filtered, and maybe it's still supposed to be, but I unsubscribe to that belief and I'm just showing up kind of normal and authentic there.
I'll leave all your links in the show notes so everybody can find you on a
All right,
platform they would like.
that sounds good. We might run into each other.
The same way we ran into each other at a conference
Yep,
many years ago.
yep, perfect.
All right. Thank you for sharing your story. I know that it will help a lot of people, and it's just very interesting to learn about all that happened before we met for me
Yeah, thank
personally.
you. I appreciate you being an honor and a witness to my story.
Always. All right, everyone. Thank you so much for listening, and we'll see you next week. Thank you for listening today. If you enjoyed the episode, please share it with a friend. And if you have a moment, please rate and review the podcast so that we can reach and encourage others to tie on their sneakers and join us out there on a run. See you next time.